So for any disease, the treatment depends on the primary etiology. Okay, what is the reason for that particular thing to happen? So if say platelet disorder, all right, if the platelets are lesser in number, they are not produced in the bone marrow. Okay, a very common condition which is called as amegakaryocytic thrombocytopenia, where in the bone marrow the red cell series works normally, the white cell series works normally, but the platelets are not there. So amegakaryocytic, that means megakaryocytes which actually produces the platelets, they are not there in the bone marrow. So for these cases, the only way is just to give them a healthy marrow which has optimal number or adequate number of megakaryocytes also, okay, which can only be done by offering a bone marrow transplant. So this is, one of the way we can treat inherited thrombocytopenia. Now there are some inherited thrombocytopenia which doesn't need such a aggressive treatment, okay, where you just give some other supportive measures, and with that the platelet function is sort of normal, okay, or it comes in a decent range so that the bleeding manifestations can be taken care of. Okay, this was about the inherited causes. There are acquired causes of thrombocytopenia also. Like a common, very common thing which we encounter is immune thrombocytopenia. All right. So after a seasonal illness, maybe 6 weeks, 8 weeks later, we see patients coming with low platelets. Rest of the blood counts are normal, but just the platelets are low. So which is called as immune thrombocytopenia. Earlier it was called as idiopathic thrombocytopenia. Now here what happens is, suppose I develop some kind of an infection, whether it is clinically obvious or a subclinical infection. So the antibodies which develop in my body to take care of that infection, viral infection or a fungal infection, most likely viral, those antibodies, after taking care of that particular infection, somehow they start weirdly acting on the platelets also and bring down the platelets. So this is called as immune thrombocytopenia. Now, almost 90% of the cases of immune thrombocytopenia are self-resolving. They don't even come to a clinical notice and they resolve on its own. But the 10% who come to clinical attention need some kind of intervention. Okay. So this was about hereditary causes of thrombocytopenia and sort of broad treatment, acquired causes of thrombocytopenia. Okay, so there are n number of causes, and every time we need to treat the cause. Now coming to the factor disorders. Okay, so if you have a inherited deficiency of a factor, as in hemophilia, then the best way is to replace that factor. All right, whenever there are bleeding manifestations, you need to replace that factor. Occasionally, what we encounter is that just like immune thrombocytopenia, where the platelets go down, after some form of infection, those infections, antibodies which are formed inside the body to take care of that infection, rather than destroying platelets, they start destroying our coagulation factors. So the coagulation factors also go down and the coagulation is affected. Okay? So those are called as inhibitors. Then if that is the case, then we need to take care of those inhibitors. At times we need FFP support or cryoprecipitate. All right. So this is how we treat the acquired form of coagulation disorders or inherited form of factor deficiency. If it is inherited, you need to replace it from time to time. Okay. But if it is acquired, then it is mainly sort of symptomatic kind of a treatment. If the patient is symptomatic, then you give either FFP or which is fresh frozen plasma or a cryoprecipitate along with other supportive measures.